My name is Yuan Yao, and I am a first-year Hematology Oncology Fellow at the Mayo Clinic in Rochester, Minnesota. So first I would like to discuss what MBL is. So MBL stands for monoclonal B-cell lymphocytosis. And it has been, the concept has been around since at least 2005, so for a while. And there are different subtypes of MBL. And one of the subtype we, in the past decade, we acquired a lot of knowledge about it. That's the CLL subtype of MBL. And as the name indicates, it is a precursor to CLL with a higher risk of developing hematologic malignancies. But there is another subtype of the MBL that's called non-CLL-type MBL, which is the focus of our study. We just don't have that much information about it. We don't know whether it's also associated with increased risk of getting a blood cancer, whether there's any increased risk of getting infections. That is why we wanted to conduct this study. We utilized our Mayo Clinic biobank. We recruited over 10,000 individuals to participate in the study, and everybody was recruited from a primary care clinic-based setting. All of our participants were over the age of 40 at the time of recruitment, and they did not have any history of hematologic malignancies. And then we take a tube of blood and run them through flow cytometry, which is a method for analysis to detect this MBL clone. And then we analyze the results. And in summary, we found that the non-CLL-type MBL, the focus of our study, it is prevalent in about 2.9% of adults over the age of 40 years old. And that actually translates to about 4 million individuals in the United States alone, so a pretty significant number. And we found that the prevalence of this condition increases with age. And it was more common in our male participants comparing to female participants. And we followed a portion of these individuals over time. And we did find that the participants who had non-CLL-type MBL at the time of screening, they were at higher risk of developing a blood cancer in the future. So, after we figured out, this condition is indeed associated with adverse clinical outcome, we wanted to understand, what are the risk factors for getting this condition. So for doing that, we conducted further analysis using our questionnaire of the biobank. So basically, this is a series of questions that covers a broad range of topics, including some common comorbidities at the time of enrollment, and also things like lifestyle factors like diet, exercises, various exposures, including prior radiation, different chemicals. But overall, we didn't find a significant association between all of these and getting the non-CLL-type MBL. But we did find having a first-degree relative with either leukemia or lymphoma was significantly associated with getting having the non-CLL-type MBL. We thought that was very interesting because potentially this could suggest our germline genetics, so the genes that we inherited from our parents, could be playing a role here. So that's why we also conducted a genome-wide association study, and we identified one potential target. So for our future studies, we're going to focus on following up these study results.